After an operation, patients experience all kinds of weird sensations. Patients that have had nerve compression for a long time may have that nerve awaken, only to be irritated and numb and tingly, and this sensation we call paresthesias, where it feels like ants are crawling on that extremity. Sometimes that is very uncomfortable, and if it's burning and uncomfortable as that nerve is awakening, you may get prescribed a medicine called either gabapentin or Lyrica to decrease the discomfort from a nerve that's abnormal or that's awakening. We also do that when a nerve is being compressed before surgery. If the nerve is being compressed and that nerve is severely painful, then sometimes we'll prescribe those medicines to decrease the pain. Those are things that sometimes we'll prescribe, and our hope is to do that very, very short-lived, so that as the nerve is then better and normal, we wean you off and get rid of the medications. Narcotics are also going to definitely be necessary after most surgeries. We prescribe those very carefully. We're very judicious about how much narcotic we give you. We try, if people have been on narcotic, we try to make sure that we match the narcotics and that we give you as much pain control as we feel is safe. The problem with continuing to up the doses of narcotics is that the higher we go, the higher the risk that you overdose and that you literally stop breathing, which is one of the side effects and complications from excessive narcotics. So you have to be really careful. There's a very fine line between comfort and lack of breathing. Clearly, we don't want to cross that line. The other thing that people have after surgery is very commonly the muscles are in spasm. They've been traumatized. Muscles have been elevated from the bone. They've been reattached, and so the response is spasm. So spasm is very common after surgery. I always prescribe a muscle relaxant for the first several weeks and sometimes even several months until the muscles are recovered enough from surgery to no longer hurt and spasm. In addition to that, sometimes we'll prescribe a combination of supplements for people that have had a fusion or any kind of surgery. One of the keys to your nutritional supplements should be that your protein intake is optimized. You want to really boost your protein intake. You want healthy sources of protein because protein is a key component of muscle building, muscle recovery, bony healing, and even tissue healing. When we see people have low protein levels, if your albumin is low, what'll happen is your infection rate goes up because your tissue doesn't heal very well. Your bones have a lower chance of healing. And we want your muscles to recover too. So we need protein to recover from the trauma of surgery. In addition to that, we need people to take calcium and vitamin D to boost the bone healing. Vitamin D also boosts your immunity. I like taking vitamin C. I think vitamin C is very important so that you can boost your immune system. Vitamin C also kind of acidifies the urine. So especially women who tend to be prone to having a urinary tract infection, it actually acidifies the urine and makes it less likely to get a urinary tract infection after surgery. I also recommend people are following a really well-balanced diet, but I understand that probably the best thing to do if you don't have much of an appetite, which is very common after surgery, is to drink protein shakes, because again, protein is key. So I like bodybuilding shakes. I don't like Ensure or Promote long-term. I like them in the hospital because you need very high nutrition, high calories, maybe even short-term high fat. But when you're outside of the hospital and you're healing, I want you to build your muscles like a bodybuilder would, with high protein, moderate or low carbohydrates, low sugar. I want to make sure that we're giving you healthy sources of protein that are easily digested. So I like whey protein and I like bodybuilding shakes to help you to heal. Sometimes I tell people to drink 2 to 3 of those a day, especially if your appetite is suppressed. And like I said, it's very common to have a very low appetite after surgery. That's totally normal. If you have that, it's not abnormal. Just give yourself time, drink that protein diet, let everything come back slowly, and then eventually you'll have your appetite again. Taste is also sometimes different after surgery. Some people say their taste buds have changed temporarily. That happens as well. The other thing is that if you get steroids during surgery, sometimes the anesthesiologist will give you steroids to minimize your swelling. Well, if that happens, steroids can have an impact on your abdominal function. Antibiotics have an impact on your bacteria in your stomach, your normal bacteria. So I like patients taking probiotics. There's a lot of little supplement tricks that you can do to help boost your stomach function. Your stomach, especially if you have surgery around your stomach to get to the front of the spine, may not work normally right away. Constipation is really common after spine surgery when you have narcotics to control your pain. So how do you avoid constipation? Walking is one of the keys. Water content, so drinking and not getting dehydrated, is another trick. And then the other thing is I recommend psyllium husk to kind of keep your bowels moving. It's a high fiber component in most supplements that you can get, like a colon cleanse type supplement you can drink that'll help keep things moving. And if you have severe constipation that surpasses the ability of any of those things to work, then you probably need to talk to your doctor, because then they can prescribe something even more powerful, something that's prescription strength to help you to get your bowels to move again. Another supplement that I really like that I've been taking for years and only, believe it or not, recently realized that it can actually help my surgical patients is called nitric oxide. For years, when I was lifting weights to get more muscular and to build muscle in a rack, I would take a supplement called nitric oxide boosters. And those supplements, what they do is they create dilation of our blood vessels. They increase the blood flow throughout our entire body. It increases blood flow into the muscle cells. So it engorges the muscles with blood. What does blood carry? Oxygen. Oxygen is the healing component of life, right? So when we're having any kind of surgical procedure, and even just living life in general, nitric oxide has been shown to increase healing. It's been shown to decrease blood pressure. It's been shown to increase blood flow and oxygenation to our cells. So I think nitric oxide is one of those recently determined and poorly understood components of really having a healthy body. That blood flow and that oxygen capacity that it enhances is very important for patients, especially those that are healing. I take a nitric oxide supplement every day. But those are all small tips to help people to heal properly. And then a multivitamin, of course, take a multivitamin every day just to get the balance of nutrients that you need, including the B complex vitamins, so that you have a good chance